let's jump right in. Today, we're talking about the single fastest growing risk facing businesses right now. And here's a hint, it's not something you can see. It's invisible, it's spreading, and it's costing companies billions. Okay, take a good look at this graph. See that red line shooting upwards? It's not just climbing, it's absolutely exploding. This is the shocking rise in serious workers' compensation claims for mental health conditions. It's a risk that's literally outpacing every other hazard in the workplace. So what does that explosion actually look like in real terms? Get this, 35.7 weeks. That is the median time someone is off work for a serious mental health claim. We're talking more than 8 months. That's over 4 times longer than for any other kind of serious injury. Just let that sink in.
And the cost in dollars, well, it's just as jaw-dropping. The median payout is over $67,000 for a single claim. Again, that is more than 3 times the cost of your average physical injury claim. The numbers are just staggering.
So let's zoom out. What's the grand total for the industry? A massive $1.19 billion every single year. I want to be super clear here. This isn't just some HR line item. It's a huge financial and, more importantly, human crisis that every single leader needs to get a handle on.
And here's the thing, doing something about this, it's not optional anymore. The legal ground is completely shifted, creating a whole new level of urgency that no organization can ignore.
And don't think this is some problem for the future. Look at this timeline. The new laws, they're already in effect as of April 2023. Practical how-to guides are coming this November, and by December 2025, you can expect full national enforcement. The clock is absolutely ticking. This slide really gets to the core of it all. The big change is what we call legal parity. It means that psychosocial risks, things like burnout, chronic stress, bullying, they are now on the exact same legal footing as physical risks. Your duty to prevent burnout is now just as serious as your duty to hand out a hard hat on a construction site. It's a game changer. So, okay, we've got new laws, a new focus, problem solved, right? Well, not exactly. The numbers we just saw tell a very different story. Our old ways of doing things are clearly failing. So let's dig into why. Does this list look a little familiar? Yeah, it's the standard playbook. You've got some basic awareness training, maybe a strategic plan that gets written and then sits on a shelf. You send out an annual survey that tells you about a problem you had 6 months ago, and then you have your employee assistance program, the EAP, which usually only gets called in when things have already hit crisis point. It's all reactive, it's all about just ticking boxes. I mean, on the surface, it looks like we're doing all the right things, doesn't it? So why are those claim numbers still shooting through the roof? The answer isn't in another policy or a new program. It's about something much more fundamental. It's about a human disconnect. At its heart, this is a crisis of disconnection. People are struggling, but they feel like they can't say anything. They're afraid of being judged, worried it'll affect their job, or they just don't want to be a burden. And frankly, a lot of the time, the trust just isn't there to have an honest chat with their manager. So what do? They put on a brave face and they suffer in silence. To really fix this, we have to change our entire mindset. We have to move from reacting to crises to actively preventing them. It's not about having more emergency tools. It's about building a whole new culture, a new daily habit. It's time we installed a seatbelt for mental health. Now, to really get why this idea is so powerful, let's take a quick trip back in time. I've got a question for you. What life-saving invention was created way back in 1885, but then took another 85 years to become standard? Yep, you guessed it, the seatbelt. And the parallel to what's happening today is just perfect, because it wasn't just a clever invention that made seatbelts a part of our daily lives, it was legislation. And the real tipping point was a law passed right here in Victoria, Australia, back in 1970. See, that law didn't just force us to use a new gadget, it kicked off a massive cultural shift. Buckling up went from being a choice to being a reflex, something you just do. And the result? It now saves thousands upon thousands of lives every single year. So just like those laws created a culture of physical safety on our roads, these new psychosocial safety laws are giving us the exact same opportunity for our workplaces. This is our moment. It's time to build that culture of psychological safety. It's time to buckle up for mental health. So what does this mental health seatbelt actually focus on? It's simple. It looks at the very first warning sign. If you look at all the official psychosocial risks, the whole list, The one thing they all have in common is that the first indicator is always a person's emotional state. That's the starting point. That's where we have to focus our attention. And here's the catch. You can't spot that early warning sign with an annual survey. No way. To see it early, you need something much more human, much more real. You need trust. We have to literally build a bridge of trust so people feel safe enough to share how they're really doing, long before they get anywhere near a breaking point. And this is how you build that bridge. It's not about forcing everyone to talk to a professional right away. That doesn't work. Real trust is built in layers. It has to start with helping people connect with themselves, then giving them a safe way to connect with trusted peers, and only then connecting them to skilled support when and if they need it. Let's break it down into 3 simple steps. First, connect with self. We give people easy, daily tools to check in with themselves, to build that self-awareness. You can't explain what's going on if you don't even know yourself. Step 2, connect with others. We help create trusted pairs or buddies, creating a safe space to share. This makes talking about how you're feeling normal. And finally, step 3, connect with support. We make the pathways to things like mental health first aiders or EAP super clear and easy to access when someone's ready. This whole system, this is the seatbelt in action. And the best part? The data proves this works. 77% of people using this approach say they feel more supported. When they're facing a tough time, that number jumps to 85%. And maybe the most incredible stat of all, a 4.5 times reduction in loneliness. That's huge. And for all the leaders and managers watching, this one is for you. 100%. 100% of leaders using this kind of framework report a massive improvement in visibility. They can finally see who on their team needs support and when they need it. It lets them go from being firefighters to being proactive, caring leaders. You know, at the end of the day, just like putting on a seatbelt became a shared responsibility for everyone in the car, psychological safety can't just be an HR policy. It takes a real community of care where every single person feels they have the permission and the tools to check in on themselves and on each other. So I'll leave you with this final thought. As these new laws come into full effect, you have a choice to make. Is your goal simply to tick a box and be compliant? Or are you going to seize this moment to build a genuine community of care that actually protects your most valuable asset, your people? The choice is yours. Thanks for watching.